So let's go over this assignment, that is obtaining a health history from your patient. This will be a practice interview. You can do it with one of your peers or somebody from your family member. It is pretty self-explanatory, but I still wanted to kind of go over a few key points here. For this practice interview, please identify the interviewee by initials only. Okay, so over here, initials only, not their full name. Emergency contact person here. So this contact person, that's emergency contact person, their initials and how they are related to the person you are interviewing. Source of data will be your interviewee, of course, not a secondary source for this assignment. A reason for seeking care, presenting problem. It could be a real problem or it could be just regular annual physical checkup. For present health status, this is a subjective document. Use patient's own words. And whenever you use patient's own words, you can put them in quotes. That's the best way to do it. This one, again, goes over just current medical conditions, checking all that apply. And if nothing applies there, you can put denies all of the above. But if there is something that is not listed in this one, you can check mark on this other and type it in. So moving on to the next page. So current medications. That includes prescription, over-the-counter, herbs, and vitamins. What I see here, like as a problem, is students or nurses even sometimes not putting the exact dosage along with milligrams or micrograms, and also frequency, how often they take it. And this is another piece here, last dose taken. Don't just put yesterday or something like that. You do need to put exact date, and also if it was taken in the morning, afternoon, or in the evening, and reason for taking for any of those medications. When we go over allergies, when you are asking these questions to the patient, make sure that you are also going over any kind of food allergies. Over here it mentions latex, contrast, tape. What you want to keep in mind is there is no judging whether the response is an allergy versus a side effect. As long as you are also asking them what type of reaction do they get that food or that medication that they're saying that they're allergic to. For example, codeine can cause horrible stomach distress if not taken with food. But some patients believe this is an allergy. So we are not judging them. We just need to put it as patient states that they're allergic to this and then type of reaction. Because if you're in the hospital filling this data out, your pharmacy needs to know all this. Because they might be getting some kind of medication, and if we think like they might have some side effects, we might want to kind of change it, tweak it, or they might still have to take it, and there will be that piece of patient education that comes in. Explaining it to them that they might just experience those side effects, but this medication, certain medication, is really crucial for treating whatever they are going through at this time. So keep that in mind when you're asking these questions over here. Current medical treatments, that's self-explanatory here. Past health history. When you're asking childhood illnesses, this is the illness they actually have had. This portion does not mean immunizations. Make sure that you're not putting immunizations here. This is like the diseases they actually had. In this one, these are major problems. Please do not go into details of if they have sprained ankle or something. Moving on to immunizations. So these dates, as long as they know it, and some may not know the dates. And at that time, especially if it's a different kind of cohort, different generation. So writing childhood is okay in those scenarios. When we go over last examinations, sometimes they might not remember the exact date. So try to find out, whatever date, as close as they can remember. Within a year is okay. So you want to kind of put that there. Over here, a few terms that might be new to you. Gravida would be number of pregnancies, and para would be number of live births. When it comes to family history, if you need an extra sheet, I think these should kind of expand. Yeah, they do that. So that's good. But if they have like too many uncles and aunts, I had a student that they interviewed somebody who had like maybe 5 or 6 of those. For this particular assignment, you do not need to add all those 5 or 6 unless there's like a big medical issue that you want to specify over here. Now, personal and psychosocial history. So for this one, you might want to kind of go back to your text, how to ask these questions. When it comes to diet and nutrition, again, check your text, what kind of questions and how to ask these kind of questions. And it has like very detailed information on those. So that should help you clarify those. Functional ability, that's very self-explanatory. Again, mental health, your book explains it very well. Do check that one out, please. This is self-explanatory again, personal habits. Even with environment, again, check your text. One example of environment would be, I think students struggle with this one. If somebody had a surgery or something, you want to make sure that you're asking how many steps to climb to get to their apartment or wherever they live at. Okay, so that's just one example. But if you go back to your textbook that's being used in this course, that should give you more detailed information on that one. Again, review of systems, self-explanatory. If there are any comments, you can put them here. And if you're coding your patient using any direct codes, you might want to kind of say patient stated or patient reported. So there's nothing that I feel like I need to kind of clarify here. Just finish this whole thing, fill this out, use non-judgmental, demeanor when you're asking these. And this assignment, with this assignment, you have to be careful that this is very confidential at the same time. So you need to download it, get it done, save it to submit this assignment. Good luck.